the maracas, I go chick, chicky, boom, chick, chicky, boom.
Welcome to No Laughing Matter with Cuba Pete, a show that takes a critical look at the disparities between medical school education and society's growing healthcare inequities. Join Dr. Pedro Cuba Pete Greer each episode as he interviews the experts working to transform medical education and ensuring that future doctors are trained to provide equitable and compassionate healthcare for all communities. Dr. Greer received the Presidential Medal of Freedom in 2009, honoring his dedication to providing health care to underserved populations. As Dean of Roseman University College of Medicine in Las Vegas, Dr. Greer is committed to creating a medical school of the future where students embrace the need to unite the heart and science of healthcare. And now, the host of No Laughing Matter with Cuba Pete, Dr. Pedro Cuba Pete Greer.
Well, good day, everybody. I'm Pedro Joe Greer, and I'm the Dean at the Roseman University College of Medicine. And welcome to Cuba Pete. This is a podcast about the interaction of society, healthcare, and health education. And we are honored today to have Dr. Ravin, who is currently serving in the position of statewide psychiatric medical director for the Division of Public and Behavioral Health, the Department of Health and Human Services, State of Nevada. He is a board-certified general adult and forensic psychiatry, and also, as I recently found out, a quite accomplished musician. And if you want to see some of his work, go to YouTube, and it's called Another Life. And the other life is the fact that it's a group of professionals that are there now playing music together. Leon, when did you get here to Las Vegas?
In 2006.
2006, and where did you come from?
You
had trained in Pittsburgh, right?
Correct. Yeah. So I spent 5 years there. I first did my 4 years in general adult psychiatry, and then I happily did another year in forensic psychiatry, doing the fellowship. As a matter of fact, loved it so much, I asked my program director to fail me so I could do it again. She refused, but I definitely would have another year of that.
I love it. Why is it important to have somebody like Dr. Ravin here? Well, it's very simple. Number one public health problem in this country today, in my opinion, is mental health. Would you agree?
It certainly has a lot of room to grow. And when I came to Las Vegas, as a matter of fact, the field was so in dire need that I was told pretty much, pick what you want to do and you're guaranteed to have a successful professional career.
But you're decided to take a position in a public position to lead the state. What are your plans to improve the mental health in this country, or at least in our community?
So let me backtrack a little bit. Okay, when I came here, I did not come to lead the state. I was just another psychiatrist working for the state of Nevada and continued doing that in various roles in the first few years. I don't necessarily even see myself as a leader because for me, it's not a one-man job. You really have to understand multitude of perspectives of those who are in need, those who set policies, those who have to fund the healthcare services. And you also want to listen to the professional community because they have their perspectives of what our patients need. So being a leader, it's not something that I would impose on myself. I'm actually blessed to work with a phenomenal team with the Division of Public and Behavioral Health and DHHS, and I love every minute of the support I get from them. And it's so heartwarming to see the people whose hearts and minds are in the right place and who really care about the outcomes for the community.
Well, that's led by somebody whose heart is in the right place, who sees the mission and the importance of what you're doing. We have a program which we call Empowered, which is for opioid use disorder pregnant women and recent mothers. And we are now expanded to the state in Utah. But that is all a consequence of a behavioral health disorder to go into an addiction and all the complexities that go along with it. Because people forget that when somebody has a mental illness, it's not just they that are being affected, but all those around them. And now that's the perspective from a gastroenterologist, hepatologist. Having said that, I would tell you that in my career and almost 50 years of practicing medicine, I would say 80% of my cases with GI disorders, or at least their complaints, the complaints were a brain-gut connection, and it was generally a mental health disorder, whether it was anxiety, depression, stress, all the different things that goes along with it, that presented to the wrong doctor. That was me. And how do you see the future of mental health in our community?
If you don't mind, before I answer that question, you really struck a note with me, and I really wish I had you as my attendee when I was a medical student at school. Because so we had a case on the GI floor. It was a young teenager, and every morning at home, the person would vomit and stay home from school, and had went through all kind of workup. Nothing was on GI. We actually rounded on that patient on the GI inpatient floor. And the attendings were trying to think of yet another test to run to find out what was going on. And the behaviors really were not seen in a patient unit. It's like, has anybody asked what it is like for the teenager to go to school and what they have to deal with? It's because sometimes people's psychiatric distress or psychological distress is manifested by the physiological symptoms.
100%. And go ahead.
Yeah, so when you're talking about plans for mental health, I don't think you should ever look at one discipline segregated from all others. I really love to see, and we have primary care physicians, so those who are interested in it, taking on other disciplines to know this, because you never treat individuals' symptoms. You treat an individual.
Yes.
And they happen to have multiple healthcare needs, and they quite often intertwined. You cannot treat depression or bipolar disorder outside of concerns of hypertension or diabetes. You cannot treat someone's obesity without necessarily being concerned about their psychological state.
I agree. And I don't think the emphasis is being put on the mental state of the individual in medical education as it should be.
I can certainly would like to see, I certainly would like to see more of that being taught in the medical schools. I have seen different medical schools taking various approaches. Some have just a short-term psychiatry rotation to the 5 to 6 weeks. Others just introduce like half a day, once a week, longitudinal. Cannot tell you that one approach is better than the other. I'm yet every day I'm learning more.
What I would like to see is various things. When a student presents a case, number one, talk about the disparities of that disease in our society and how it adversely affects perhaps the patient, number one. What were the ethical issues that came in that prevented this patient from having the appropriate care? And how does behavioral health play into this in this patient with every single case? Because you're going to have that, whether it is a patient getting ready for a transplant or it's a patient that just walked into your office. That all has to be evaluated. We have to quit separating mental health from physical health.
Absolutely agree.
And it's very interesting because I mentioned this at the beginning, but you're a musician. Actually, you started off a musician. Your parents forced you to go to med school.
Well, so yeah, I played musical instruments since I was probably 7 or 8 years old. Yeah, my parents always were convinced that I would make more money in medicine, even though after I graduated, I was working on those. And as an intern, I was making $50 a month. There you go. The physicians were making $200 a month. So I don't quite think that people back then, at least in Belarus, were going to medicine to make money. But I guess in the hindsight, my parents were right.
So, and your outlet, and I invite people to follow this on YouTube, is Another Life. And another life is a life away from your professional life. You want to talk about that a little bit?
It's not Well, I guess to a degree you're right, but I am collaborating with a lot of professional musicians, and all of them are accomplished in their own ways. They have played with various bands, so they have significant solo projects. Uh, well, recently I started collaborating with people who are not even in the United States. I work with really talented musician now from Norway. Yeah, Johannes Stahl, and he's just amazing. He worked with various genres and happened to meet each other play video games in the chat. It was like of all the places. And the latest project I've done with him, and I'm super blessed. But you are correct. The name Another Life came from the idea that all of us are doing something with our lives, but we get together and we record something in another life. And the initial was like, do one song and disperse. And then the sound of the musicians came back. We did another project, and then another project. That's why like Another Life project is the name of what we do.
Which I think is also important as a physician, because there is an art of medicine. It's not all science. And when you have an artistic outlet that allows you to enjoy even more the art of the practice of medicine, that's how I see it. I don't have that artistic outlet. I have family that has it, so I can observe it through them. But it's the fact that you look at things outside the box in a director of psychiatry at a statewide level like you are. So thank you for making our community healthier and safer for the individuals. And thank you for your music. I think that's really cool. Let me ask you a question. If you had one thing you could say to the audience out there, whether it's about another life or about psychiatry and mental health in this community, what would you tell your listeners?
I want to give you a quote from Richard Bach. I actually have it next to my office, right by the door. Argue for your limitations, and sure enough, they're yours. So don't let your beliefs or beliefs of those around you to be constrained on your life. If you truly believe in something, or if you truly enjoy something, go for it.
Yes, that's beautiful. That really, really is. Leon, and in my cultural background, being Cuban, I would call you Leon. That's how you say it in Spanish. Thank you for what you do. Thank you for your contributions, your leadership. But most importantly, thank you for being here in Las Vegas. Because without you, there'd be a big hole in mental health in this community. And that's something that I see as a major public health issue. I see it also that it's not just for psychiatrists, but like you said, it's a team. And we have to look at other levels of care to be able to expand out to the population we have. And because of the work you're doing, people can live healthier lives. And hopefully we could take care of all the mental health issues that we have in this country, and particularly locally.
Thank you. And in return, I would like to thank you for being here and providing leadership to the next medical school. We'll really hope it, because this community needs a lot of people like you and a lot of new doctors that I hope your university would be able to train in the near future. And the mission that you have and the accomplishments you already can demonstrate are just phenomenal. And we can't have enough of that.
Well, thank you. It's a big team effort. And so we're really proud of that. And we're also very proud to say that he has a faculty appointment at Rosemont as well as at UNLV. And so we are honored to have with us today Ravin, one of the, in my opinion, the most accomplished professional. And finding out just recently about his musical talents was very, very cool, especially listening to it go on YouTube. And with that, folks, I'm Joe Greer with Cuba Pete. Let's make our community better. Let's all work together. Thank you.
If you enjoyed today's podcast, please subscribe, like, and comment on your favorite podcast platform. If you'd like to support the groundbreaking work that Dr. Greer is doing at the Roseman University College of Medicine, please donate at the link below. Thanks for tuning in to No Laughing Matter with Cuba Pete, as together we work to unite the heart and science of healthcare to serve all in our communities. See you next time.